Hey, I'm Andrew with 10 Minute Therapy. In today's video, we're going to continue our look at anxiety, picking up from where we left off last time when we examined anxiety in the brain. Today, we're going to examine anxiety in the body. More specifically, we're going to answer the question, what's happening in my body when I experience anxiety? And I think this might be one of the most important videos we ever make because we will be directly examining what's happening during a panic attack. So let's get right to it and start the timer. So as we continue into our look in anxiety, understanding what's happening in the human body during periods of anxiety all the way up to full-on panic attacks is really important. Again, as I said in our last video, my goal is to help us understand and remove some of the fear associated with anxiety. And when anxiety reaches a point of a panic attack, because the body's response is so visceral, what we find is that statistically there are a large number of people every year in the United States who will check themselves into an emergency room believing that they are having a heart attack, when in reality, what they are experiencing is a panic attack. It's been estimated that more people will fall into that category than the sheer number of people actually experiencing cardiac arrest going to an emergency room. So what that tells us is that not only is anxiety a serious issue in our country right now, but also that we as a people don't have the proper information and education to understand and recognize what's happening in our bodies during panic. So to pick up where we left off last time, we examined that within the brain, we have this part of our brain known as the limbic system. And within that limbic system is a small piece of our brain known as the amygdala. And when the amygdala reacts to what it believes is danger, it triggers what we often just call our fight or flight response. And it's during this fight or flight response that we may experience a full-on panic attack. I mentioned in the last video that one of the first dominoes to fall in this process of fight or flight response is a stress hormone that we often refer to as cortisol. Cortisol releases into the brain, and its one job is to really speed everything up, which, again, in the presence of true danger, in a time when I really need to fight back or run away, is a really handy thing to have. But cortisol is one of the first dominoes to fall, and then it triggers the release of what we call epinephrine, and more commonly, we refer to that as adrenaline. And as adrenaline courses through our bodies, its job as well is to speed things up. And so I want to just examine with us some of the different parts of the body that begin to speed up that lead to us feeling this panic attack that for many people they might believe is actually a heart attack when it's not. So the first and foremost part of the body that we need to look at would be our heart. The human heart, obviously a very vital organ that pumps blood through the rest of our body, an organ we cannot live without. And when cortisol and adrenaline are released into the body during a panic attack, the heart does two things, and we refer to these as hyperdynamic. Essentially, our heart speeds up, but it also pounds or beats harder than it normally does. If the heart simply sped up, that alone would probably not feel as visceral as a panic attack does. But in this hyperdynamic response, what we see is faster beating of the heart, upwards of 150 to 200 beats per minute, as well as the heart pounding, beating harder, stronger than it normally does, even during periods of intense exercise. And this very visceral response of the heart pounding and beating faster, especially when it happens suddenly, partially explains to us why so many folks experiencing a panic attack might believe that they're actually suffering from a heart attack. And so the heart speeding up in a hyperdynamic response is an important piece for us to pay attention to. If that's something you've experienced, you might want to talk to your doctor or therapist about whether maybe what you're experiencing is panic or is it a medical condition. In addition to the heart speeding up and beating harder, our lungs do a very similar thing. During a panicked response, our lungs breathe faster and more shallow. Essentially, what's happening is we are over breathing. We are getting CO2 out of our bodies quickly and oxygenating our blood very, very rapidly. And so this shallow, fast breathing makes some people during a panic attack feel like they're going to pass out, when in reality, they're actually over breathing. And so we have a heart that's beating faster and stronger, lungs that are breathing faster and more shallow. Both of these for the sole purpose of keeping us alive in the face of true danger. But again, we might experience a panic attack sitting in the safety of our own homes, in a place of work, on a bus, in public transportation, at school. And so sitting in a place where one is safe, but the physical body is reacting with these physiological and visceral responses would be a very disconcerting thing to experience. Hence why so many people panic in response to the panic attack. In addition to our heart and our lungs, a few other things happen that I think are really important for us to mention here. One would be that our blood pressure increases. Blood pressure increases as part of this sympathetic response. That's a word we can examine later. Or fight or flight response. Our blood pressure increases and our muscles begin to constrict. And one of the more fascinating things that happens, and a reason why people feel shaky or even a little bit sick or nauseated when they experience a panic attack, is not only do our muscles constrict and our blood pressure increases, but our muscles, especially our large skeletal muscles, are actually designed to keep a special reserve of glucose that is broken down during a moment of panic and released immediately into the bloodstream. Now, the reason our bodies do this during fight or flight or panicked responses is to give you an instantaneous energy burn. And that instantaneous energy burn is like pouring fuel into a fire. It's putting fuel directly into your bloodstream so that, again, in a moment of true danger, you would be able to fight back or run away. But once again, if I experience a panic attack when I'm not really in any danger, I now have a heart that's beating faster and stronger, lungs that are breathing more shallow and faster, adrenaline coursing through my veins. And now in addition to that, I have glucose flooding into my bloodstream in order to give my body an energy burn that it really doesn't need right now. And so all these things together can cause the whole body to just feel sick. Why so many people feel like they're having a stroke or a heart attack, when in reality, what they're experiencing is panic. And the last piece of this puzzle that we'll mention today, but it's certainly not the least of all these, involves our digestive system. During a moment of panic, a fight or flight response, our digestive tracts actually basically pause. They shut down. They lock up tight. The theory behind this is that in a moment when one needs to run away or fight back, the body is pushing all of its energy to these systems, the heart, the lungs, the muscles. And there's really no time or energy to be wasted on digestion. And so digestion happens more when we're relaxed, when we're calm. During moments of panic, during this fight or flight response, our digestive tracts lock up tight. And this is the reason why so many people feel sick to their stomach. It's the adrenaline coursing through, it's the glucose going into our bodies, and it's our stomachs and our intestines locking up tight. And so if someone has recently eaten and then they experience a panic attack, this food has nowhere to go now. It's why some people might throw up or feel like they're going to throw up. It's why many people feel sick. Again, the combination of a locked up digestive tract, adrenaline, and glucose, it's the perfect storm to make one feel nauseated. And so all of these symptoms happening together One other thing we need to recognize is that they don't just happen at one time, they happen very quickly. When a panic attack sets in, all of these body responses are happening rapidly. And so it doesn't give an individual much time to recognize these signs and these symptoms and respond appropriately. But the truth is, and the reason we're sharing in this video today, is I want to take some of the mystery away. If anything that's been said in this video strikes you as something that maybe you've experienced before or even recently, or maybe it sounds like a loved one you know, I want to encourage you today. Talk to your doctor, talk to a therapist, explain through these symptoms. Number one, make sure there's nothing medical going on. And number two, understand that maybe, just maybe, there's some panicked response happening in your body that could be dealt with and treated through counseling. Well, as you can see, our time is just about up. So I want to close out our video today by saying that if you heard anything today that sounds familiar, I encourage you to talk to somebody, talk to a professional, talk to your counselor to work through this anxiety and this potential panic. In our next video, we're going to look at what do we do with this panicked response in the body? How do we slow it down so we can maintain some semblance of control? But until then, I'm Andrew with 10 Minute Therapy. God bless.